patient with our slow start. We're going to spend the next hour and 15 minutes or so talking about trauma-focused cognitive behavioral therapy, or TF-CBT, in Latine communities. This will be in my bio stuff in a second. Like, I'm not a certified TF-CBT trainer, so I want to be really clear that what I say is not like TF-CBT canon. It's what I've kind of figured out through trial and error in the last 10 years. So a lot of this is just meant to, I'm offering it as things for people to like react to and see how much it matches your practice experience. And I really want people to feel comfortable asking questions or like adding to what I'm saying, like throughout the presentation. For folks online, we have several people logged in as well. We're going to help kind of moderate and make sure that any comments that are coming in online are on my radar too. So, all right. So I'm Liz Franklin. I'm the Associate Director of Behavioral Health at CLUES. I teach a class in the School of Social Work at the U that focuses on clinical work with kids and adolescents. And then I'm the chair currently of the board of the Consorcio. I've primarily worked in community-based mental health prior to becoming a supervisor. So I worked as an elementary school Latino family liaison, a children's mental health case manager, a school-based therapist, and then outpatient therapy just super briefly. I'm not Latina. Again, I'm not an expert. So this is just meant to be kind of lessons from the field, things to help us further our own reflection. As I was getting ready to give this presentation, I spent a lot of time just thinking about all the different families that I've done this with. And so I just want to give them a shout out and like thank them for walking through this protocol with me or through different modules of it. And also to Nancy Ortega, who's in the pink shirt. So she like gave me a lot of thoughtful feedback as I was getting this ready, and her comments, like things that are, there's a lot of things in this that are specifically because of comments or feedback that Nancy provided. So thank you, Nancy, for how you helped deepen this. So thanks. Okay. So a couple other things that you should know about when I've used TF-CBT to help you understand some of what I'm going to share is I've almost always used TF-CBT to process sexual abuse, a parent's deportation, exposure to domestic violence in kids' families, or a combination of those things. And often it was a combination of like those things, some combination of those things. It always was happening in cross-cultural relationships, either between me and Latine families or me and African-American families, based on my practice experience. And within the Latine families I worked with, the kids often chose to work in English, but not always. And then their parents almost always participated in Spanish. So there was like the conjoint sessions were often bilingual to a certain amount.
Yes.
Yeah. That's fine.
You let Renata in the Zoom so she can.
Oh yeah.
Please.
Yes. Hold on just a second. I'm gonna make you a co-host quickly so that
Progress.
on a sec here. I guess we're sharing again. Oh, okay. Hold on one more second here. So I can make Brenna a co-host. All right, so Brenna, you can let people in now.
Thank you.
Yep. All right, the other thing that's really important to understand is I've never done TF-CBT as quickly as they say we should be able to do it. So the whole thing about this can be as short as like a 12 or 15 week protocol. That hasn't been my experience, and you'll understand more about why as we get into this. All right, so let me get back to my slide. It's usually taken me like 6 to 8 months to do the full protocol. And when I was thinking about that more, whoops, sorry, folks. I think it's probably closer to 8 months that it's taken me to do the full protocol because of particular time being taken with parents and things. And you'll hear me talk about that later. Okay. So a lot of people will talk about So I've heard lots of different concerns from people about like using TF-CBT, especially when they first start. And one thing that's want to normalize, like if you haven't done a lot of TF-CBT yet or lately, is that all models feel clunky when we start implementing them, no matter how good of a model it actually is in terms of like the fit between how you tend to process things and what the kids you're working with need in order to do their healing. But so in addition to like the general clunkiness of doing a new clinical model, I've heard people talk about how it feels clunky. They're not sure how to effectively involve parents. They're not sure if the standard parenting module really works clinic or culturally for the families that we're working with. It can feel kind of rigid, like the structure within the model can feel almost rigid to people. And people often feel like the narrative is almost kind of imposed on kids, or that's like their fear that it will feel to kids like we're imposing this really detailed trauma detail rich narrative on them. And what I've really come to appreciate about the model are, sorry, just a sec. I've somehow got multiple screens being shared, and so I can't figure out where I am here. Okay.
Because this one's not showing that one.
Okay.
So I would,
We're just gonna
redo it.
stop. All right. All right, are we
Now it's there we go.
awesome?
Yes, I'll
All right. We're just really in it together today. All right. Which I can make a whole narrative about how or like a whole like analogy of how just like with kids, like we're walking along with them through the uncertain and difficult stuff. I wish I had a sud skill right now because I'm like an 8. Well, TF-CBT humor. Okay, back at it. So what I really like about TF-CBT when I was thinking, both when I'm actually doing it, when I was learning it as a very new therapist who like didn't have any other trauma model yet that I was working with. And when I've looked back at how I saw it working for kids and families, I think it helps. A lot of people that we work with come to therapy with like not a clear sense of what to expect or what therapy looks like or how it works exactly. And like it gives us a really clear way of how to start explaining that to people from the very beginning. We know that for things to be trauma informed, we want it to be very predictable and that we want there to be a lot of transparency about what we're doing and why. And there's a ton of predictability, which hopefully leads to like emotional safety in the model. And so there shouldn't be surprises for the people doing TF-CBT about what's coming next, big picture. Most of the folks that I've done TF-CBT with, most of the kids had like either anxious avoidant or anxious ambivalent attachment functioning, and so did their parents, which is really common that we work with people without secure attachment styles, or not every single person in the family or like the parent-child dyad are going to have secure attachment functioning. And that's like important because that really changes what people expect from helpers and what people expect to get in response to expressing their feelings. And so I think TF-CBT gives us a nice structure for also helping people know what to expect from us as helpers. And it builds in this like accountability that helps us establish trust with people with attachment challenges. Where like we build trust by like saying what we're going to do, doing it, and then saying, look, I did what I said. And that's like every single module in the protocol. Like you say what you're going to do, you do it, and you check in about how it went. So another thing is like when we talk about how kids learn things, one of the ways people explain that process is connect, explore, and mastery. So for kids to learn and grow, they first need to have a connection to a caretaker. And then that security, that safe base lets them go out and explore some stuff, try some new things. And they do that, like go out, come back enough that then they have mastery over a new skill. And if you think about how the protocol is structured, that happens all the time too, where it's like this really clear, safe base or hopefully safe enough base in our therapeutic experience. And then we're going out to explore things. And we keep trying things until we figure out this is what's going to work for you and for us. And this is the new way that we do it together. And then it also really like the protocol like really clearly maps onto like the symptom clusters of PTSD, or more broadly, the way that we know trauma tends to impact people. And so there's really good congruence there about what we're trying to work on and what it's set up to work on. And wait, there's more. There's even more things I like about TF-CBT. Okay. Oh, is it not work? It's not. Okay, now we go. So the other thing is, like, a lot of the parents that I've worked with didn't have health insurance. And so getting their own therapy services was really difficult, even though they often shared parts of their kids' trauma and had their own trauma experiences on top of that. And so the really clear, like, parent involvement and the really clear structure for how do we help parents like support their kids' process, and how do we have like kind of permission to do some parent only work in the module, I think really works well for the communities that we're serving. Like, there's a lot of work that helps destigmatize like trauma because of how we start by just normalizing things. If you're doing it well, I think it helps, it keeps it really client-centered, and there's a lot of collaborative decision making between you, the kid, and their caregiver about how do we know it's time to take the next step, and how do we together decide to keep doing harder and harder things in therapy. There's lots of ways to bring in experiential things like art or movement, play. And so that really helps us make it work for people who have different processing strengths. Like, parts of it are very verbal because it's a narrative, but there's lots of other ways that we can get people thinking and feeling and processing in every single step. And then the other thing that I really like is that the way we do, like, you can do the protocol in ways that make space for kids to have different developmental functioning within the same session, which is really important. So to step back from that a second and make that make more sense, when I was thinking about this, I kept coming back to like 4 different clients in particular, and 2 were second graders that I worked with that were 2 of the first kids I ever did TF-CBT with, both of whom had had a dad get deported, and both of whom had become selectively mute, which also, doing a narrative-based intervention with kids who don't talk was kind of an interesting choice. But when you only have a hammer, everything looks like a nail. And so like TF-CBT was what they were going to get until we like knew if it was going to work or not. So I was thinking about those 2 kids. I was thinking about 2 teenage girls that I worked with when they were about 15, who'd experienced sexual abuse in multiple parts of their life. And so like those are the 4 kids that I kept coming back to. And with one of those those second graders, like, she was 7 when I was working with her, but her dad was deported when she was 5.5. And so she was still at the end of like the preschool developmental window when that trauma happened. And like the immediate aftermath of her dad's like removal happened. But then she was in like that middle childhood developmental window by the time I got to her, because she was like 7.5, kind of flirting with 8. So like TF-CBT worked really well for that older part of her, like the 7-8-year-old kid that was showing up in sessions. But there was still that preschooler inside of her that also needed to process what we were doing. And what she ended up like figuring out, or what, I don't know if, what she ended up doing in our sessions was really cool. So we would do like kind of classic TF-CBT for 40 or so minutes of the session. And she was a school-based client, so I was really careful to end on the early side and make sure we had some like really good containment so she could go back and do the rest of her school day. And we ended up playing this game where she would hide a stuffed, we would play either hide and seek with our bodies in my like tiny school-based office, or we would hide this little like elephant stuffed animal that I had. And it was like this beautiful metaphor of like the lost was found over and over and over every session after we did like the more explicit talking about it work. Then she like somehow let that younger part of herself also have that experience of like, I lost something important and now I'm finding it again through play. So kind of that reworking, I wish that could have happened with my dad in some way, could kind of happen through her play with that stuffed animal. So that's what I mean by this last bullet point, is like we can have kids participate in different ways and still be like keeping fidelity to the TF-CBT protocol. So is that making sense to people? Okay. Right. This is the last like kind of foundational thing, and then we'll get really into the protocol, if I remember correctly. So another couple of things just as caveat. So I've only done TF-CBT in outpatient or intensive outpatient settings. So I always had some amount of access to an office to do parts of this if I wanted to. Although I did do a fair amount of in-home work. I made tons, I make tons of like handwritten guides and like pictures and illustrations as we go, so that by the end of the protocol, kids basically have like a book that we've created together if they want to keep it, about what they learned in each protocol. And I've always done this with like when parents are able and like interested in doing this. I've had a really high frequency of parent only sessions and lots of parents joining at the end of sessions to be looped into what their kid and I practiced that day. And if they have like homework, a lot of kids I had teach parents like skills or ideas that they were learning, or like ask them to kind of help us take it to the next step in those like end of session check-ins if parents weren't with us the whole time. I did have some parents like that wasn't helpful because of like really challenging family dynamics. And so, or because that felt like too much of a power inversion in the family. And so then there'd be a lot of like asking kids to go home and teach a younger sibling or a cousin, so that they still had some amount of like practice that way. I always, whenever I could, I would do parent sessions in home just because I think it allowed for more comfort, unless they specifically said they'd prefer to come to my school office when I was a school-based person. When I was doing in-home, whoever was around for the session, like did the session with us. So there was a couple kids in particular where like their cousin cohort got the whole prac part of the protocol because they were always around. And so like we all played together or all did art together to figure out the skills. And then even when I was doing like a lot of in-home work in the model, the narrative and conjoint sessions like always happened in my office, just that there was some containment of that most raw trauma exposure for the family. All right, so now we're going to start going through each step in the protocol, and I'm just going to share like here's some things that I've noticed helped me over time or helped this work better for families. Again, like stop or ask questions or add as we go. So in the assessment part where we do like some sort of trauma inventory before we start the protocol, so that we have like a before measure and an after measure of symptoms when we're doing it, especially for certification, but when we're doing it with like the highest fidelity. So it's really important to find instruments that have been translated, and when possible, both translated and normed for use with Latine clients. Because if we find instruments that have only been translated, we can't be assured that they're going to actually measure the things they're supposed to measure for folks outside the group that the test was originally developed for. So if people have access to the UCLA PTSD index, that's one of the measures that has been both translated and normed. And I think it's also a really nice instrument because some of the output or some of the results are visual. And so that makes it easier for folks who aren't as literate to like still make sense of what we're getting out of the instrument. If possible, it's always helpful to check with people who've used an instrument several times to talk about bias, just to see like, is there anything in here that would skew scores that we can somehow either just like know when we're interpreting the results, or like try to adjust a little bit of that part of the model. I don't know if a psychologist would agree with what I just said. That was a clinical social worker talking about testing instruments. So just want to name that. And then just in general, we want to always remember that culture is going to shape symptom report, both like big culture and family culture. And so we want to be like just open and curious about like if kids, for example, skew really heavily toward like somatic reports and don't feel comfortable or don't even have like the self-awareness totally yet to give us as much information about their internal experience, especially when it comes like their self-talk, or some of the connections between like this trigger makes this happen in my body or this trigger makes this happen in my feelings. So we just want to be like curious and open to that. So psychoeducation, I love that this is where we start in TF-CBT, because it really aligns well with like, I think what we tend to do after we do a diagnostic assessment with a client, which is we have the like, what do we call this conversation, which is a lot of that is like, what diagnosis are we going to use? Like, what do we think is the best way to describe the problem? But then it goes straight into like normalizing, like, this is what we're going to call this. This is what what you told me about how things have been different from you since the hard thing happened. And that is how it impacts almost everybody, or like many people, most people in your situation are going to have the same responses because of how our brains and our bodies work to keep us safe. And so that really sets the stage from the very beginning to like build in psychoeducation and like normalizing things to try to help reduce some stigma, and hopefully even help like other people in the family start to like think about and talk a little bit more openly about their own mental health to some degree. This is one of the times where we might get the "my kids have it so much better" question. And so it may not come until later, but I think almost every parent I've ever worked with at some point has asked me, like, I don't understand how my kid can be having such a hard time, because I've given up so much and worked so hard to give them what they have and for my family to be here. They have it so much better than I did, and they're still having this bad of a time. So having some scripts prepared of how we might respond to that and like use that as a way to increase our understanding of their kids' experience and normalize that sense of like disconnection and not understanding their kids' experience can be really important. Okay. So when we're doing,
There's a question about what are some ways you have talked about that?
what do we call the why does my kid have it
Why is my kid
having such a hard time?
Right.
It's almost always a variation on like, I'm so glad you asked. That comes up with almost every family I've worked with. It's such an important thing for us to understand. It's just like lots of like normalizing and validating the question, and then talking about how, I mean, there's like a lot in it. So we're going to try to like braid together a couple different things, and it may all be in one conversation, or it may be things that we come back to at different points too. But one piece is to talk about like basically like the generational transmission of trauma in families, and like by this time I often have a sense of like some of the parents' own trauma history. And so one piece might be talking about like, you know, we tend to pass on to our kids what helped us survive or what kept us safe. And sometimes we pass on to kids like strategies or ways of like doing relationships or managing our feelings that don't fit where they're growing up or the context that they're in. This also may not be the first thing I say, but this is often something that comes up along the way. And so just like kind of validating and normalizing, like sometimes even our best intention to support our kids and to help our kids grow doesn't teach them some of the skills that they need, because all of our kids grow up in a different time than we grew up in. There's particular things about like growing up in a different country from where your parents grew up. And so some of the context that you grew up in and like had to respond to or navigate is going to be different than what your kid needs. And like, that makes sense. A lot of parents who've immigrated have that experience of like, I don't know some of what my kid needs to know to be successful here. And like, I don't understand some of what my kid is like trying to share with me. So that's a big piece, like at some point, like we get to usually. Another piece, I also don't immediately start talking this much. Like I usually ask a couple more questions about like, what are some of the main, like, tell me more about that. Or like, what are some of the places where you're the most confused about your kid's reaction, or where it makes the least sense, or where it like bothers you the most. And so that also helps, I think, get to like the parent's perception, which we can also process more about, like, is that part of how they were responded to as a kid when they had a hard time? And like that kind of responding to that can then make some of the later conversation easier. I feel like there's a really important piece that I can't pull out of my brain right now. So I'm going to like turn to the room for a second. Like, what else have people, because I know everybody in this room has like experienced this. So what else do people put out there when parents raise this?
I talk about like when I hear that question, like real response to trauma differently. Like it could happen to two kids from different families at the same time, the same trauma, but each kid is probably very different trauma. So, you know, just because one might have more ability to cope with it based on either support or just like natural. But doesn't mean the other one has the immobility. So that's kind of what I say to them, that because they're responding well, you know, their kids are their own person, they will have different reactions to their child.
So Jesus said that he will normalize like each kid responds to trauma differently based on things like what other support they had available to them, like temperament or kind of their existing resilience. And that works really well too with like helping parents understand, even if your kid's trauma history mirrors yours in really clear ways, like it's really common to have the two of you react very differently to the same stressor because of those kind of circumstantial pieces. What else have people shared or seen clients respond to?
I think naming the fact that they have worked so hard for them not, for their kids not to be in the same situation that they were.
Yeah.
And that might look different and it could be confusing, but again, that's why they're there for, and also like validating that they are doing something different by bringing them to services.
Yeah.
So I guess this is more about them than the kid, and so I will turn into them to like reassure them.
Yeah.
And help them make those connections and make sense.
Yeah. So Mika raised a really good point that like, this question is more about the parent than about the kid. And so she tries to really honor how hard parents have worked to have their kid have this different experience, and that's real. I mean, that's a big deal that they've done that, and and they're also like they're doing things different with their kid by bringing them to therapy, which they often didn't get themselves. And so even if it's like unfamiliar or doesn't make sense, it doesn't mean that it's wrong. Like sometimes that's a good sign that it doesn't feel familiar to what we've done before. And I think the other piece is like, there isn't like a cozy resolution to this. It's just important to like create the space where you can sit in that like ambiguity and ambivalence about like, that's so painful that like you work so hard and like it feels this like out of joint or like hard to understand to you. Like it just gets that bigger like ambiguous loss piece that is so embedded in immigration. But I'm going to move us forward. So, okay. So one of the things like stood out to me really quickly with the parenting module when I started working with it is it's really designed to like address externalizing symptoms, or like that's where it takes us. It's a relatively behavioral part of the model about like how do we help your kids like, or how do we help you respond to your kids like tantruming, or how do we help you respond to your kids like not, how do we use like natural and logical consequences and do a lot of behavior management. But I've seen that a lot of the clients that I've worked with have had such pressure to kind of help their family by not expressing a lot of their distress, that it was also about how do we make space for that in the module where it's about the external stuff, but it's also about understanding the more internalizing things. It's also tricky to have the parenting modules like placed so early in the protocol, because it's when our relationship is newest with parents, and especially working cross-culturally, it's when I felt like I had the least kind of social capital or trust built up to really start asking people to like trust me and try some things different just to see what happens. And then just to see like maybe this could be helpful. Like it sounds like bullshit, but let's just give it a try. And like let's not make up our minds ahead of time. And like just, you know, in the parenting module, but throughout the protocol, like we're asking families to look directly at problems, to talk openly about problems and feelings. And that can really challenge or uproot like long established coping and survival strategies. And so throughout all that, like with all good clinical work, it's like we lead with curiosity, we respond with curiosity, we reflect with curiosity, both in the meetings with our families and as we're like processing afterwards. This isn't going to match exactly one like across the two sides of the slides, but it's like just leading with that, and that there's no right or wrong answer. It's just us figuring out what makes sense and what do we think is going to work based on what hasn't worked so far, and like what we're learning together about your family, you as a parent, and your child. I think it's important to be thoughtful about who we're including in parenting work. So like if there's an aunt that takes care of my client for a lot of the time, I'll ask explicitly, like, how much of this do you want them to know? Especially if it's like new kind of responses to distress. Like, is this somebody that could do that with your kid as well? Or are we also going to have to build some kind of code switching in here where it's like, with me, we're going to try doing it this way. Your aunt probably is still going to expect you to do it this way. Or with your grandparents, they're probably going to still respond the ways they have been. I queue up the parenting like part of the protocol early, but I keep coming back to it throughout because of just increased understanding and like trust being built and parents feeling more and more willing to like share kind of the deeper parts of their concerns or uncertainties. And then I think it's really important, and this is where, like, again, I'm not a TF-CBT trainer, but like, you know, the protocol suggests some stuff to focus on early, but to me, it's like, what's the quality of life win that we can get here? So I worked with a family where I actually worked with the two kids conjointly. They were like 18 months apart in age, and the family came to therapy because there was a risk that their dad was going to be deported. And it was like the weeks leading up to like the court appearance where that was going to be known. And the kids were just wrecks. Like, they couldn't sleep. They were super emotional. They were reactive to like really what had been like fine limits before. The parents felt totally unsure of what to do and were like panicked themselves about this like possible separation. And so the first thing we focused on was sleep. And we spent like, we did the key part. We didn't do any assessment. We did some psychoeducation, and then we jumped right into like parenting/relaxation training. And like our main goal was, how do we build strategies so that people feel calm enough to sleep? Because if people are getting enough rest, everything else we're going to do goes better. So we started a lot with that. And we did a lot too about like separation, because that was such a trigger for the girls at that point of any time they were disconnected from one of their parents, but especially their dad. And so that was like what we really focused on initially, was like what we knew was going to help people feel more positive connection and regulation leading up to that date. So is that making sense to folks? Okay. I also want to acknowledge it's hard to talk about this and like give client examples without sharing an amount of detail that's distressing. And so I've already talked a few times about sexual abuse and like deportations of parents. I'm going to keep talking about it like in passing as we go. And so please just do what you need to do to take care of yourself. If that's like move while we talk, take deep breaths, doodle, whatever helps you is very much welcome. So this is a duplicated slide. I apologize about that. So the two things that are different in this slide than the one before is it's important to kind of keep your antenna up for how much guilt is impacting a parent's current response to their kids' difficulties. So one thing that I've noticed a lot is in families where there was a lot of early domestic violence, or even just like not so early, but in particular in families where there's been domestic violence, and I'm working with them after like one of the parents has left the abusive parent, and like now it's the parent and the kids like together. I've seen like that parent who's bringing the kid to therapy have so much guilt and like shame about what they let their kid experience, like let in finger quotes here, that it makes it really hard to enforce limits because they feel like they're being mean, or it's like one more thing they're putting on their kid now. And so that may not be like the first question you ask, but just like I always keep that queued up about like, how do we start bringing this into our conversation and like normalizing that sense, and also challenging like what actually helps kids feel safe, and it's having like consistency and predictability, which comes through limit setting. And then I think whenever possible, I try to help parents think differently about positive reinforcement, because I've heard a lot of parents feel like that's bribing their kid, or their kid should just know to do it, like they shouldn't have to like reinforce them. There's also a lot of logistical barriers to like physical positive reinforcement of like giving kids or buying kids things sometimes. But part of what we're trying to do here is make sure there's like a balance of attention as we start to talk about the harder and harder stuff. So like in some ways, like that social capital thing again, where we want to build up some like positive attention and make sure the kids noticing the good things that they're doing or how much they're trying, as we start pushing them, not pushing them, but as we start moving together into like harder stuff, where people are going to be sharing like more vulnerable what may feel like ugly parts of them. Like we want kids to have that experience. Like we see all the good stuff, we hold all the good stuff at the same time that we're talking about the things that make you feel bad about yourself. So some of that's like explained to parents. And then I also use like the work analogy. Like, do you like it when your boss tells you when you're doing a good job? And it's like, you know, your kid does too. And like that helps them listen to like the correction that you have to give them too. Okay. Another thing I love about the protocol is where relaxation falls. I think this is so smart. And it's something that has really affected how I practice, where we don't do any, I mean, some of the psychoeducation normalizing stuff can feel triggering because of just what we're talking about. But aside from that, we're not talking about much of the vulnerable stuff yet. We're going to immediately get into like, how do we make this manageable? So that by the time we get to the more consistently hard stuff, we have a plan for how we're going to keep it tolerable with each other. So I think it's important that we're holistic when we decide what to include with relaxation and coping. I tend to have a menu that I create with kids where it's like, listen, I've done this with a lot of kids right now, like by now, right? So I'm really old. And so here's some stuff that I think every kid should learn. And then we're going to add some stuff to figure out what works for you. And there's like 2 different breathing exercises. Like I want kids to have 2 different breathing strategies, one that can be done like in groups of people without other people noticing much. And then other stuff that might be more noticeable, like volcano breathing. Like it's hard to not notice if somebody's doing volcano breathing. I want kids to all know like body scanning, just to have that like practice about like how do you check in with your body and respond to it. I think progressive muscle relaxation is like helpful to introduce, but not everybody really likes that much. But aside from those like really basic things, then it's kind of the sky's the limit. Like if dance is helpful to the kid, dance is awesome because that's bilateral stimulation and like a lot of like limbic system calming down stuff. I spend whole sessions listening to different kinds of music with kids and like going back and forth, sharing like what music helps you feel calm. Here's something that helps me feel calm. Do you like it? Like what helps you feel energized? Like just different things that we might want music to help us do. One time I was doing that with a kid and I played a Ben Harper song for him and he really liked it. So we played some more Ben Harper. And then at the end of the session, I had to tell his grandma, like, I forgot how many references to marijuana there are like in our first songs. So if he like comes home from therapy and is playing songs about weed, like that's on me. I'm sorry. And she was just like, oh, Liz, like that's the least of our worries. It's like, okay. So think about what you're playing before you play it. If prayer is helpful to folks, if indigenous or traditional healing practices help, like that's a really important thing to build into like the menu. Anything that's about how does this family create together, and that can be like cooking, it can be like gardening, like that whole piece about creativity and like improvisation is a really important part of trauma healing. So it's like really, it's a nice way to get to know your kid and their family's values and just interests a lot more. It's also important to get caregivers. This is one of the times where it's really important to get caregivers in the practice when possible of like participating regularly, because we want them to have lots of opportunities to build up their coping skills too. Because like the next stuff that we're going to do is going to ask a lot of them as their kid's caregiver. And I'm like really transparent about that. Like, I know it's hard to like make this work with your work schedule, or I know it can feel weird to come meet with your kid's therapist so much. Like, here's why I want to make sure that we're connecting this way now, because we both want to be ready to support your kid when they get to like some of the later stages here. And then we want to make sure that caregivers, in addition to building their own skills, are like really building their recognition of the skills their kids trying to use. So one of the things that they do that I remember like thinking, I don't know, in the protocol is the whole idea of like taking a break, or like kids walking away from arguments. Like if a kid just walks away from a parent without any context, like that can feel so disrespectful that then it can just trigger a whole new like set of issues. And so it's that whole piece about like what's going to work for this kid in this family with these caregivers, and when can we like make sure that when can we support caregivers like seeing it differently when we're experimenting with like maybe this time letting the kid walk away can be like a choice that you're making and still be a way that you're retaining like parental authority or like power in your family right now while we're trying to figure this out together. Okay, anyone who's like ever talking about therapy has seen a picture of these. Like people, all the clues people are like, oh my God, the feelings flashcards, Liz. Especially Jesus is like, okay. So a couple of reminders about when we're doing the affective modulation pieces is like, it's important to make it bilingual and really getting into like, in your family, like what are the different words for the levels of MAD? Or in your family, like how do you guys talk about this? We also want it to be multimodal. So it's like we want the words because words are easy to share with other people, but if we can also figure out like what's a color that goes with that or a sound or a movement, like a lot of times, especially with like the youngest kids that we can do TF-CBT with, like they're still actively building fluency in English. And so they may be kind of stuck between languages in certain parts of their expression. And so just thinking about like, if we don't have like a real strong connection to this in either language yet, or if we're kind of like transitioning from one operating language to the other, how do we have like some backup information processing stuff involved here so that kids have like lots of different ways to experience this? Eileen, it's really important to do a lot of somatic look at like, how does this feeling show up in your body, and like really getting into like some of the small differences between what's the difference between like mad and worried or excited, or because like stuff can get so mixed up, like just that teasing it apart back into like separate categories can be super helpful. And then also thinking about like every family and every school has feelings rules. And so how do we also keep our antenna up for like, which are the feelings that are like the least okay to express in this family, or what are the feelings that are least okay for this kid to show at school, at least the way they're showing it now. Because we may want to do some like additional focus on that stuff before we get into the more triggering parts of the protocol. Is that fitting with like people's experience who've dabbled in TF-CBT or done more than dabble? Okay. Anything you would add that you've seen helpful to kids in this part of the protocol? Yeah.
Hi, I'm Julia. I'm very much a new face for everyone. I just moved to St. Paul last week. Welcome.
Julia just wins the record for like fastest connection to Consorcio from. So she just joined, it's her first meeting and she just moved here a week ago, so.
I think that what's also been helpful is, I know we talked about her in the previous slides, that drawing like a basic drawing of the body, mapping out where feelings show up and talking in the conversation of the somatic expressions of feelings has been really helpful, as well as both like basic bilingual and English, either the color emotion wheels, feelings wheels, as well as I find the use of emojis incredibly helpful with adolescents. In terms of describing feelings and how you're feeling today, how you're feeling at the end of the session, start of session, all that stuff.
Yeah, so Julia highlighted like not just talking about the somatic stuff, but actually mapping it onto some sort of body outline. One of the best parts of being a school-based therapist was I had like access to their laminator and their huge rolls of paper. So some kids who I thought would really get into it, like we'd actually make like a life-size like outline of their body. And that was like, oh my God, so exciting. But like having actual bodies that you can like draw these different cues or connections to. Emojis can be super helpful with adolescents. And then like trying to find feelings like color wheels in English or Spanish or both have been really helpful. I'm just repeating for the folks online. So, okay.
It's where we can get creative and tailor to them and their liking and their experiences.
Yes, this is one of the places where we really get to like color outside the lines. Haha. And like make it match the kid. So, before we get that, so the other thing that I want to talk about too is like when I did my training and I was taught how to do the SUD scale about feelings, like it was about one feeling and it was like a 10-point line, and it was like every number had words written next to it. Like, does that match how people were taught to do SUD skills too? Where it's like, we say this is about sad, and then we have like numbers and each number gets described. I found some kids really struggled with that. One, because like their response to their trauma experiences was a mix of several feelings. And it's like, as I got more fluent in the model, I got a lot more comfortable saying like, what's the stew that we're describing here? Like, what's the mix of things that like shows up for you? And then I had some kids really play with like, they really didn't have words to describe like 8, 9, 10 at their SUD, at the top of their SUD scale, but they were very clear about like, within this range of numbers, I cry, within this range of numbers, I have a stomach ache. And or like there's very distinct colors that went with like the different levels for them. And it's like, I just was so literal when I was getting trained that it's like, I'm going to do it exactly how they taught me. But it worked so much better for kids when I got a little bit, when I followed their lead about how to make the SUD scale more flexible and like more true to how they were processing and experiencing things.
I have a question. Is
Yeah.
when doing those subscales, I really like my first thing, like emotional trauma.
Yep.
So like, does it make more sense to do it like a particular feeling? Maybe they have a feeling a lot, or maybe just a more general feeling of when you're upset. Because sometimes kids have like a mix of anger and sadness. So that you wouldn't just focus on anger, because you would do a separate one for anger and sadness, right? You would just make an upset subscale. Is that kind of work, or would you want to do a focus one?
Jesus was asking about like how focused do we make the SUD scale. So because like for some kids who've really not gotten this totally, like we've started with something easier, but then like we'll make a second, like something pretty clear cut of like, how does your sad change as you get more sad? But that's usually not the feeling kids are having when that I worked with when they were thinking back about their traumatic experiences. And because like this is going to be the main tool we use when we're writing the narrative, it's like we want to make sure that we're making like kind of the real SUD scale, or this like important like SUD scale match like the feelings they have when they think about the traumatic stuff. And so it's important to figure out as much as we can, like what's the mix of feelings and like what's the specific name kids want to use for this. And sometimes it is upset. Sometimes it's like mad, sad, or sometimes it's like scared, mad, or like even like 3 or 4 different feelings mixed in there. But like what's like their stuff that we're trying to keep an eye on as we work on their narrative and they really start to get more stirred up. Does that help, Jesus? Excellent. Okay. So the cognitive coping, I lost the word, module. I use painter's tape a lot in this one. I also use painter's tape a lot just in general when I'm doing like cognitive triangle stuff. And I have seen kids really like this part of the protocol because it helps them feel like their experience is more under control to do this like systematic, like how are our thoughts and our feelings and our body experiences like impacting each other. So as we start to do this like basic practice about how do we pay attention to what we're thinking and how that's impacting our feelings in our body, and then how do we notice that if we can change how we're talking to ourselves about this a little bit, our feelings and our body sensations can also change. We want to keep our radar up about how stigma may be influencing like the negative self-talk or the automatic negative thoughts that we're practicing shifting a little bit. This is also a good time to like do things bilingually and see where do they have the more intense reaction, like when they're talking about this in English versus Spanish, or how does their like self-talk, even kind of like messaging to themselves, like shift between the two languages. When we're thinking about like strengths or the themes that we want to build on in their positive self-talk, we want to be looking at their strengths that include like cultural identity, how they've developed language proficiency, like faith, their like what they think the plan is for them, either from like God or just like the universe, their role in the family, and if they take a lot of pride from being like a good cousin or like a good older sibling. It's just like, what's this particular kid's source of like strength and sense of like, I'm an important person with some skills here that we can build on. taking into account that some of those roles can also be a source of stress and pressure. And so like really thinking about where is this helpful and where might we be adding to pressure in a way that's not going to like be helpful. And then especially for kids that are like right on the cusp of being able to like think about their thinking. So like those 7, 8, 9-year-olds in particular, sometimes having a worry monster to imagine they're talking back to can help with this, because it's a pretty abstract process. Like we're asking kids to just like hold in mind their mind and like their thinking and like go back and forth between different messages. So having that like visual to imagine they're talking to can be a way to help them into some of this like more cognitive work. Is that making sense to folks? My worry monster is always named Cadwallader. So just putting that out there. He's always like fuzzy and blue and has like, he's just like a fur ball with like legs and like arms coming out of him. And it's like, because a lot of this, it's like, I'm not just asking the kid to draw their worry monster, like I'll draw mine too. And if they want to know about Cadwallader, I'll share a couple like benign things about him. And if not, like I just have him there with me. It's a good reminder to like pay attention to my own self-talk. Okay. So this is where shit gets real. Right? So this is like the decision point. Before we start the trauma narrative, we check our work with the kid and their caregivers about like, here's what we said we would do to get ready. Like, here's the stuff we've learned along the way. Do we feel like it's time to take the next step, which is writing the trauma narrative? And so we want to be clear that like we have a good set of relaxation or coping strategies that we can use in session and then also after session to like manage the distress that this is going to cause. We want to make sure that this is like a relatively stable time for the family. So there isn't some huge thing coming up that we think could really add like distress to the system. In some families, we get to this point, or some kids, we get to this point and it's like, it's not time. And so we stop. And like we may come, there's one young adult now that I've worked with since they were 14. And we did prac, I think 3 times before we actually wrote their trauma narrative, because we would think it was time, we would do prac, and then we'd realize like stuff's not safe enough in some important ways in their family system to go further. It's like we would try it again. And finally, I think on the 3rd time, it was like, okay, like we've got what we need to do this. So I have gotten really grateful for the Lifeline activity that I was taught in my training. I have jars of shells and rocks in my office and a bunch of yarn. And so I usually do it with those examples, but this has been really helpful for me. Like before we start really talking about this, it helps me understand like where this trauma fell within like other important experiences in their life. And with complex trauma, like that more felt or like all in one place experience of like how this fits in with the rest of the stuff was really helpful to me. This was actually one of those teenage girls that I talked about. This is one of her lifelines. And so we took a picture of it at the time just because she wanted to be able to look back at it. And then at the end of therapy, she said it was okay for me to keep the picture and like use it for training. But so we would, this is always like, I can think of several different sessions where we did this activity in particular, just because of like how emotional that session was. And like, just, it's so interesting to see how kids approach it. So like this adolescent, like when she was doing it, you'll see how she like wrapped the yarn around the hard stuff, but not the good stuff. And like that was like a really interesting and like a lot of information when she made that choice. Like she labeled like important things so that we could understand like how stuff fell. And what she was processing, what she had been like brought to therapy to process, I forget now, but it was either like the 2nd or the 3rd rock in that clump of like 5 bad things. But to go into her narrative knowing that like this is what it was sandwiched between was like really helpful and like setting up some of the other stuff. As hard as the narrative is, I've also become really grateful for it because it makes us ask questions that we would not want to. Like it makes us ask questions and like go to a level of detail that our client will avoid and that we will also avoid because it doesn't feel good to hear the answers. And like that's real. Like I don't go, like I often was in, like especially once I came to Clues, a lot of my trauma narrative sessions were at the end of the day just because of how my schedule was. And I could never go straight home. like after one of those like narrative sessions, I always had to at least have like a 10 or 15 minute buffer where I was like therapeutically organizing my office or like just doing things to feel kind of in control and like have stuff put away. Like this is a hard part for both like the adults involved and the kids, but it's really important because it helps us like get deeper into like the somatic and like the trauma symptoms pieces than we might otherwise get to. So in this session, like I always we all want to make the person as comfortable as we can. So like what I have found kids generally choose is that they'll be on a chair. We're often like, I'm sitting here, they might be sitting here kind of facing, we're like facing this way. They usually have fidgets or like stuff to draw with or Play-Doh or whatever, and I'll like type. And so like they just talk, and then like I'll ask for like more questions, and like I just type what they tell me. And then like I don't think I've ever had a kid actually be the one who wanted to type or who wanted to be the one like actually writing stuff out. We decided together like which traumas to write about and in what order, because I think a lot of the training really emphasizes like pick one thing and do the narrative about that. But it's important then when there's like complex trauma to also have like an awareness of like these things are all interrelated. And like for most kids are going to get the most impact if we can address a couple different components here at least at the same time. But it's like that needs to be a decision that we make with the kid. It's really important to ask the kids we're working with, not just like how it impacted them, but how they saw it impact their family. And so things like how their mom was so sad and like seemed lost after dad was deported, or like the conflict it created in their family system when they like reported their whoever for abusing them in the family. Like that's such an important part of the trauma as well. And then like I often translate the narrative with the kid, because it's an additional way of doing exposure work, and it helps them think through how do we talk about this with my parents like in Spanish if they didn't write it in Spanish. For some kids, like they're good translators and like it's really doable for them to help translate the whole thing. And for other kids, like I've translated big chunks of it outside of session, and then there's like a particular part that I want them to help me translate because I think it's some of the most important to have processed in Spanish as well. Is that making sense to folks? And then again, it's like throughout this, we're using that SUD scale to just like, what number are you at? How are you doing? We want to keep them between 4 and 7 so that they're getting like the actual like activation that's manageable, and that then like leads to this being stored differently in their brain long term. Anything people want to add about the experience of doing narratives or what they have seen be helpful to kids? All right. Oh.
And that sense of like the mastery component
Mhm.
where, because we're using the set scale so often, where are you at? I don't know if I'm gonna start with. Let's practice a skill. So I have a particular time when we just like stop and do yoga pretzels, so we stretch. And then we go back into the trauma narrative and how do you, what number are you at? Okay, I'm at a 5. And because they would notice themselves that they're, I guess, able to regulate, they would almost like get the sense of confidence, like about it. And I never thought I would be able to tell you this story, but I just did.
Yes.
I think that was really close.
Yeah, Nancy raised a couple different important things. One is just like how she has seen kids' sense of mastery develop as they've over and over had the experience of like, I can get really upset about this, but then I can actually be part of myself feeling better. And like that repetition really helped them feel like more empowered. And then like getting to the end and having told their story, which most kids think is impossible or sounds too hard or will be too hard, to then have done it like is a huge deal. And especially when you've done the exposure work, like I tell kids at the beginning, like my goal is that we do this enough that you feel bored. Like when we like read your narrative, and they're like, that's like, I can't, like, there's no way I can like think about this and feel bored. And then when they get to that level of like, this is another story about me. It's like, I mean, it's like fireworks are going off. Like I want to go out in the hallway and do like air punches and karate kicks. It's such a cool like thing to see them like have click. Okay. The other thing that you made me think about actually, Nancy, is like co-regulation is so built into this. And like just thinking about how isolating trauma is and how much kids need adults to buffer their experience. Like I think that is a brilliant piece of TF-CBT is how it like actively requires that co-regulation if we're doing it well, because that is so corrective. Okay. I have not had kids do a ton of in vivo exposure because a lot of their exposure was about like it didn't need to happen based on like what they were coming to therapy for. The things I have actually seen kids most consistently need to do is to practice feeling safe in their bed after like different kinds of abuse. And like it's hard, but like it's also relatively like easy to do because it's like their bed's there. Like they don't have to go anywhere special, like they don't have to do anything out of the ordinary to like go to the place they need to practice things at. But we just want to be really careful that like everybody understands their job before we try in vivo exposure. So like if this is something where like parents are taking the kid, like parent and kid, what are you each going to be doing and how do you work together to like practice seeing the scary thing or being by the scary thing and feeling okay. And if we have like other family members that might be involved in it, making sure that they also have a sense of like how can they be helpful during this. And then for the actual conjoint narrative pieces, we want to work really hard to prep the parents. So again, like we've been working for weeks at this point about how to help the parent have their own skills to manage their reaction to like hearing their kid share their story. I'll share, like we share particular like parts of the narrative at times so that parents like aren't necessarily hearing it for the first time or so that they have a sense of like, this is my most visceral reaction, but how do I want to react and show up for my kid in that session? And it can be helpful also that like pre-exposure to the narrative for the parent can help us start to pick up on distortions where it's like, oh, that timeline was wrong, or that sense of responsibility for what happened. That's something that we're going to want to respond to, like in that session where the kid's like reading you their story. And so then once we get into the enhancing safety part, having worked with a lot of families where one parent was deported and there's one parent here who may be relatively isolated, like I'll ask, like, as you think more about what will help your family feel safe, do you want help connecting to like one, what's safe enough and like what is as safe as possible for your family? And then are there particular other resources I can connect you to given like the concern that you may have about your like you potentially being deported or like not being able to care for your kid because of like parents have medical emergencies sometimes or things just happen. Like how do we help you feel prepared as a single parent or a single here parent? And then one of the places where this can get really messy too is if our kid is coming to therapy to work on something that happened in the context of a family relationship and the family chooses to stay connected to that person to some degree, like how do we navigate, like how do we help the family navigate that? And like real reflection about what does this mean for your kid? Like what's the message that they might take away from maintaining this contact? And like how do they get to have their own experiences and reactions to this? And like what are some compromises we can reach if that's the best that we can kind of do at this point about like, okay, so maybe you two go to the party, but the kid gets to stay home. And like never ever is anybody left alone with that family member, like some of that act like safety planning stuff. Okay. And so then I think, so this is one of the ending things that I did with the kid that we had done TF-CBT together. And he called his like, what are the things that you learned in therapy? What do you want to remember the next time things get hard? He called it the good list because it's like the good thoughts he wants to keep. And so he made it bilingual so that he and his parents could both use it when they needed to. And this was one of the things that I think is really cool is I showed this to one of my friends who's a therapist because we were going to use it in a presentation we did. And she's like, Liz, that's what parents want us to tell their kids in the first session. And it's like, it is like, that's the stuff that like people bring their kids to therapy and want us to just like tell their kids so that they do better and like understand it better, which is like an understandable impulse as parents, right? And we talked about just like helping parents understand that like we need to set up a process where the kid figures it out themselves, because then it sticks. And like if you like mom or dad can be part of them figuring it out, like that's so much richer and like so much more impactful. And so I do a lot, especially because kids are like actively growing and developing, and like they're going to keep getting new skills and like levels of complexity for the next several years. I do a lot of normalizing for families. Like your kid may need a booster in the future, because like as they get older, they may look back at this and understand some things differently, or want to talk about some things that they weren't ready to talk about this time. And like and I say this to like both the parent and the kid, that doesn't mean they didn't do a good enough job in therapy this time. Like think about all the progress we've seen you or your kid make and how much they've grown. Like if you realize that they need to come back for a little bit, that actually shows how much you've seen therapy help, and like that you and your kid are ready to keep like drilling down or deepening it. So trying to set that up so that there isn't as like much shame and like concern about, is it okay to come back if we need to? And okay, so I love what clients say about TF-CBT because it makes me feel good about continuing to use it. So the first quote, so this was one of the two kids that I talked about in the beginning, where her dad was deported and then she just like stopped talking. And at the end of TF-CBT, she said like and this was the best I can remember it now, like 10 years later, but it was like she was so sad that she couldn't find the right words. And so she just stopped talking. And now that we had done TF-CBT, or like now that we had written her story, she had the right words again. And like it was visible with her. Like her school picture that year was like just this like that was her school picture, where she was like sad and like just palpably sad. And by the end of like our work together, like she would just do belly giggling. I mean, just like this delightful like child, like enjoying herself. Like she had a full range of feelings, and she had the words. And like that was one of those things that kids say to you where it's like it's like it was so profound and like true. It was beautiful. And like consistently I've seen kids like especially who go through the whole protocol, but even who just do prac, like I've seen their symptoms decrease a lot, and that they have a much better quality of life. Like they just are more connected to other people, they're more connected to themselves. I've seen like parents and kids like they can be a team in a different way than they were before, because their hurt was getting in each other's way. They're like stepping on each other's stuff all the time. And then the kids really like how they feel like they understand better. They understand themselves better. They understand what happened to them, like why everybody reacted the way they did. And kind of to Nancy's point, they have a much clearer sense of like their power. And that piece in particular, like that has come up in so many narratives about like, but look at what you were doing all along the way to try to keep yourself safe, or look at the times that you tried to get help, or look at the ways that you fought back. And like that is such an important piece to highlight for kids. All right, that's what I got for you. We have 9 minutes. So what thoughts, reflections, questions do people want to focus on here?
Oh,
No,
I hear what you said, that like sometimes can be a really long time, it's like narrative.
Mm-hmm.
What about with clients who just seems like who just constantly like in a crisis?
Mm-hmm.
Just constantly a lot of things happening at home.
Mm-hmm.
It just feels like you're constantly like putting out fire, you're constantly like continuing. It feels like you can never get to some of these protocols, because you're just always trying to just process whatever's happening there.
Yeah.
So what do you mean by that?
Jesus asked about like how do we.
I put the question in the chat.
Oh, thank you, Brenna. I mean, I think that's where like clinical judgment and supervision is super important, because for some families, like that's really a sign that things aren't stable enough. And they may need like additional support, like they might need like case management and or like family therapy to like help stabilize some of the stuff that keeps leading to crisis or keeps leading to such hard times. For some families, like that's part of their avoidance. And so trying to figure out like how much of this is actually urgent and like we need to respond to it this week, and it's like different than the bigger picture of what we're working on in TF-CBT. And sometimes it's like we may kind of start talking more openly about like it feels like something's always coming up, and we also know that doing this with your child is really important to them healing. And sometimes, like not always and maybe not even often, but sometimes we can get to a place of like things are going to keep happening, and most of it is hard, but it's not like life threatening or it's not like safety threatening. And so like we're going to keep moving through the protocol, and like, you know, we're not going to do the narrative until we're really sure that like things are stable enough to like tolerate that process. But like if we're waiting for stuff, like I'm not saying this is what you're saying, Jesus, but like I think we have to tolerate some amount of like not calmness, whatever that would be, like in the family or in the family system, because like it's things aren't going to be totally calm and like predictable given what tends to bring people to TF-CBT before we do some of like the deeper work. So it's like what's actually a crisis and what's like things that we can kind of throw up there to keep from looking at the like the stuff that people know we're going to ask them to look at in TF-CBT. And sometimes it's like this isn't the right time. And so we're going to do other things to help people feel better. Mika, what were you going to say?
I was just gonna ask, so you've been doing this for a long time and you mentioned a couple of things that you do with clients get some webinars. Are there any other things that you have found in your work that have been really helpful to keep in mind when doing this with webinars? Either like specific interventions or things that you tweak here and there to like round it up a bit?
Depending on the client, depending on the client and like the family, some of the broader pieces of like what do I know now can get into like historical trauma, atrocious cultural events, like, you know, racism and discrimination is important to name wherever it's showing up in stories. So I think that's one of the big things that comes to mind. Totally switching like tracks. The other thing that's been really interesting to notice is I've had a handful of kids that we did the full protocol and they never got like in that like 4 to 7 window of distress. And like every single one of those kids had an undiagnosed language processing difference like at the start of services. And so it was a really interesting thing about like really there's something different about how they're processing like language that doesn't make this hit them the same way that it does for like more neurotypical kids or kids with like without that different language processing piece. And it was still really helpful for them because they still were able to like organize their story in a way that they hadn't. Like there was still lots of intentional like skill building that we did, and it still gave their parents like a package to understand and respond to. Even if like we didn't do some of like exposure stuff the way it usually goes with TF-CBT. So like that's if you see a kid like who just you really can't get them up to like a 4 or a 5, and there is sometimes where like you're subtly trying to like turn up the flame a little bit so that we get that like distress tolerance practice. If you really can't get them up there, like psychological testing might be something to pursue afterwards, just to figure out like why is that? So
there's 2 questions in the chat. One is, what do you think about TF-CBT workbooks?
The longer I've done therapy, the less I've gotten into workbooks because I just like to make stuff specific to the kid. I mean, I think they're helpful. I think they're like really helpful examples and jumping off points. And I don't think they're like bad per se, but like I just tend to create stuff with kids in the session. And so the workbooks kind of,
Not necessary.
Yeah.
The other question is thoughts on building in self-care for newer clinicians using a model. Well, the protocol is wonderful. It also repeatedly exposes clinicians to really hard things.
I mean, I think that's one of the great things about it is like, ideally you're doing the relaxation training with kids. Like you're not just watching them deep breathe, like you're doing the deep breathing, like you're doing some of the same practice, whether you mean to or not, about how do we get ready for this and how do we like actually re-regulate in the sessions. And then I think it gets to the bigger question of like, as trauma focused providers, like how do we keep this tolerable for ourselves? And so like, I think it's important that supervisors are keeping a close eye on like what this is feeling like to people and looking at like, you're doing trauma narratives with like 6 kids right now. Like that's not a good idea. Just like, not that it's like that was a bad idea, but like what can we do to like take that into account? Or is there anything that we can do to like reconfigure this? Because that is a ton of like very raw trauma exposure. I also think I have found that the more I have done it, the more I can have like real faith that like this is worth it, that like the hard stuff is getting us to such better stuff that I can kind of make sense of it existentially about like why I'm doing it to myself and like why I'm asking this kid and this caregiver to do it. So
I liked your talking about containment afterwards, after the sessions too, of like for yourself, like
Yeah.
that being able to leave to do something that then you can leave it at work,
yeah.
right?
Yeah. And especially, so Brenna was talking about how she appreciated me saying that piece about how I try to do containment after sessions. Like, especially my kids are the same age as like kids that you use TF-CBT with. It's like in particular, like I need to go home, being able to see my kids is like different than the kids I'm working with in therapy. So, because I'm not their therapist. So, all right. I'm going to be respectful of people's time and the possibility that another group has the room reserved at 10 o'clock. So thank you everybody for coming or for joining virtually. And we'll see you in August on the 3rd Friday of the month to talk about EMDR with Latine clients. So thanks.
So we're